Hello and welcome to Hope Channel Kenya. Thank you so much for joining me. I am Kandi Odhiambo and this is Positive Living. So you might have heard the saying, prevention is better than cure. And many a times we use it in so many aspects of our lives. And today is not different. Today we're talking about prevention and my guest, Brenda Kinyangi. Thank you, Brenda, for joining us.
Thank you also for welcoming me.
From Maxwell Adventist Center for Care and Support will help us dissect prevention as she helped us dissect transmission, HIV 101, and all that. So, Brenda, let's get to it, right?
Let's get started.
So, someone might ask, HIV is treatable, yeah? So, why use condoms to prevent HIV? Why not go and, have a spree of all the types of risky behaviors to prevent HIV?
It's very important when you look at prevention, because the way you started off, you say prevention is better than cure. So as we work as human beings, because HIV only attacks us as human beings, it's always important just to use condoms. And condoms is basically one of the major ways whereby somebody can be able to prevent themselves from getting infected. We have the ABC, that is abstinence, then being faithful, and then condom. Condoms actually doesn't only prevent us from getting HIV, it also acts in other ways of prevention, like getting pregnant, also getting STIs. So it actually works largely when you look at prevention.
So apart from condoms for preventing HIV, what are some of the ways we can prevent HIV?
Like I've mentioned earlier on, I've mentioned about abstinence. It's very important if you can be able to abstain. I really encourage all the youths who are watching today, abstain till marriage. If you've not tried it or if you've not gotten into it, then just wait till marriage. The second one is being faithful. Basically, we look at all couples. I don't want only to target on the married couples, because we also have different kind of couples. I'll just encourage them to be faithful to one another, and faithfulness only comes after testing. Yeah, you cannot say I am faithful to my partner that you don't know their HIV status. It doesn't work like that. If it doesn't go along like that, it means now you'll fall to C, which is condom use. Yeah.
Therefore, why is prevention important?
Prevention is very important, because without preventing yourself, you will get infected. Very simple as that. Yeah, you'll get infected if you don't prevent yourself.
So for a person living with HIV and AIDS, and for a negative person, it's basically important that we do not spearhead the spread of the disease. That's why there is the prevention. Very
true. I'll really encourage all who have already known their HIV status. When you look at a HIV negative person, if this person has a partner that they are not sure of, and they're still indulging themselves into sexual practices, I would like to encourage them to use condoms. Somebody who's HIV positive, already known HIV positive in the past, or has gotten to know they're HIV positive, and they're still with the same partner, would also encourage them to use condoms. Because if they don't use condoms, there's repercussions. And the repercussion is reinfection. You might be thinking like, I'm here to naenda kusambaza. But at the end of the day, it turns vice versa. You get another different strain of HIV that you don't have. So it's very important, if you know you're HIV positive today, kila wakati tumia mipira, so that you avoid getting reinfection of another HIV virus that you don't have in your system.
When you're reinfected, how does it affect the person living with HIV?
For sure, it will really affect the person, because when somebody turns HIV positive today, we encourage them to start on the drugs immediately. When their CD4 count is either high or whatever level it is very important for this person just to start on the ARV drugs. If this person doesn't take precautions, that is what we talk about condom. if they decide to continue with the same behavior that they've been doing, because HIV and AIDS is all about behavior change. If they continue the same way they've been living, even the ARV drugs, as they are taking the drugs will find it so difficult to fight with the reinfections that are coming in, and still with the strain that they have. Like I was saying, for example, if you are HIV positive, your HIV strain is called Candy, and my HIV strain is called Brenda. Anytime you get close to me, it's like rain. If you don't cover yourself with the umbrella, I'll rain on you. So at the end of the day, you'll be having two different strains or two different persons in your immune system. You'll be having yourself with your behavior, and you'll be having me in the same person. So even if the drug is trying to fight and trying to boost your immune level to come back to itself, it will find itself to be very difficult, and it won't be effective as it's supposed to be. So prevention at the end of the day is better than cure. It's either ujikinge na condoms or you get more reinfections.
You know, I love your examples. I love how you put them. Remember the porridge one? Very, very nice.
You're welcome.
So basically, I, as a person living with HIV and AIDS, should not assume that, okay, I'm positive, so why not just go ahead and do whatever? Because they're still at a high risk of having complications from the virus. So someone would ask, actually, the virus, since its inception, has been so many decades. Is there a vaccine?
I won't talk about vaccine when you look at HIV. I'll really focus on prevention. I like the viewers just to focus on prevention, because there's no vaccine. I'll just go back on what I said in another show that we had with you. I said HIV is not experimental.
Yes.
Yeah. It's either you get it or you don't get it. And if you don't get it, you have to prevent yourself. So when you look at vaccine, we don't have any vaccine unless you have exposed yourself through the ways that we said you can be able to get infected. Then you come to the facility, then we see now the way forward so that you can be able to support you as a person.
Let me try to dig deeper there. Why do you think our scientists, I mean, thank God for technology and its advances, it has made a lot of strides in helping people, but why do you think it's been so long? It's been so long, but the vaccine has not yet been successful. It's still on research, because when you look at KEMRI, that is Kenya Medical Research Institute, it's still something that is still ongoing. Some of them come on board. That's why I don't want to mention any. Some of them come on board, but it cannot just surpass and being put like this one now should go ahead and be somebody can be able to use. So far, I can just say whatever is there is the antiretroviral therapy, and it's really very effective, because what it actually does, it just manages. It manages the HIV virus in somebody's system. So it's not a vaccine as such, and it's just a treatment.
But
the vaccine, it's being worked on.
It's still on research.
When you talk about the antiretroviral therapy, we talked about the PrEP and the PEP. That is the pre-exposure prophylaxis and the post-exposure prophylaxis. We talked about them on transmission, and we understand that it's very key for these two drugs in prevention. Just jog our minds a little bit on the PrEP, what the PrEP is and what the PEP is for our viewers.
Actually, the PrEP itself is the pre-exposure prophylaxis, meaning that it is before exposure. So it means if somebody is being enrolled or initiated into the drug, it's still under the ART therapy. If somebody is being initiated, it means this person has not exposed himself. And mostly according to, it is something that has just come up from the Ministry of Health, and it's still being pioneered in some facilities just to see how well it works. And the effectivity of it is how the person adheres to the drug itself. The ARV itself is how a person adheres to the drug itself. Mostly is usually considered to a couple who have different HIV status. That is the discordant couples, whereby one is HIV positive, another one is negative. Whereby this person who's HIV negative is being given the PrEP itself. For the person is supposed to take for a period of 7 days.
Okay.
Every single day.
Every single day.
Yes. Within the 7 days, the person is not supposed to expose themselves first to the HIV infection or to the partner who is infected.
But what if I miss a day?
If you miss a day, it
among
means
the 7 days.
If you miss a day, definitely it means the effectivity has gone down. It's like you've done nothing.
So I have to start over.
You'll have again to come back to the facility, see your clinician. Then your clinician is going to advise you on the way forward.
Okay. And then you were talking about
the PEP itself,
Yes.
the post-exposure prophylaxis, it usually works with, like us, health providers. I might be seeing somebody who's HIV infected. Myself, taking an example, myself, I might not be infected.
Yes.
Then I happen to expose myself an accident, or I prick myself, or something happens along the way, then I'll have to be put on PEP. I might have been walking, you yourself, Candy.
Yes.
You might be living here, jioni unatembea, or just during the day, bahati mbaya, God forbid, somebody just holds you and rapes you.
Yeah.
Then within 72 hours, you're supposed to come to the facility, and then you're being given now the PEP just to lower your chances of getting HIV infection.
So it does not stop, it just lowers the chance.
It lowers the chance. It's a big percentage. It's not a joke. It's a big percentage. And mostly it's just only considered to somebody who has been tested and they are negative.
Okay.
Then you are given both of them, you are given the PEP or the PrEP. You have to be negative. Because if you are positive, what is the need of us giving you the PEP?
No need.
There's no need.
Yes.
Even the PrEP, what is their need? There's no need. Because if you're already HIV positive, it means we'll actually enroll you or put you in the program for the ART itself, that is antiretroviral therapy, for the rest of your life.
For the rest of your life. Hold on to that thought. So dear viewer, we'll go on a short break, but when we come back, we'll talk about the side effects of these drugs and so much more. Continue interacting with us on our social media pages, that is on Twitter at @Hope_Kenya, on Facebook, Hope Channel Kenya, SMSs, just let us know your thoughts, because your thoughts matter to us. We'll be back. Stay tuned. Hello and welcome back to Positive Living. We're talking about prevention, and when I began, I talked about the very famous saying, prevention is better than cure. Why prevent? Why engage in something that you can prevent? Why do something, Brenda, that will hurt you later, when in real sense you could have prevented it? So we're basically preventing the spread of HIV and AIDS. And before we went on the break, we talked about the PrEP and the PEP and the importance in prevention.
Very true.
So they are part of the antiretroviral therapy, yes? To me, every drug has a side effect.
Very true, very true. I really support you and I concur with you with that, because any single drug that is there has a side effect. Even when you take Panadol, when you abuse it, it reaches a time it doesn't work well. Now you decide to use headaches. When you're there again, use headaches, and you don't know if you're abusing it. You continue to use it, then it reaches a point it doesn't work. So it means you have to go to another painkiller that will still work on the pain that you're going through, so that you get better. So when you look at the ART itself, that is the antiretroviral drugs or therapy itself, also has its own side effects. But the side effects are the normal effects that usually go along with it. But after some time, the immune system or somebody's body gets used to it. But if it becomes so major, we usually advise all our patients and clients just to go back to the clinician and tell them, by the mimi sisikii vizuri, ama ni sikuli kabisa, ama miguu inaniuma, or all those things, so that the clinician can be able to see, now what can I do for you, just to make you feel a bit better while you're taking the art itself.
What are some of these side effects?
You might get some fatigue, which is normal. You can get a bit of dizziness because they are very strong drugs. You can get some bit of headache or numbness, which is very normal. But after some time, when you're starting, after some time when it gets used to your system, actually all goes well. Definitely.
So someone might be wondering, I'm in a situation and I need the PrEP or the PEP. Where do I get them?
You can visit any government facility. Even now, right now, some other private facilities are still offering, because the government the Ministry of Health itself has really tried to make sure that all the supply has been able even to reach the private facilities, so that we may be able not to only refer to the public or the government facilities.
Okay. So is it something I can also get over the counter, like let's say aspirin or
you can be able to get it, but not all but I usually say, why go through the counter?
Yeah, that's a good point.
Why go through there?
You mentioned that.
Why go through there, and all these things have been set for us free of charge? It's just good for somebody just to visit any government facility and get the best. I usually say the best services, because I know how I work there. I've been working there before, and I know how it is.
Okay. So thank God for PrEP and PEP.
Very true.
But still, human beings are human beings. And with the inception of these drugs, I might say that there's PrEP nowadays, so I can just go around and just have sex with whoever. I can do what else? I can use drugs, inject myself with and share, needles and all those injectables. These are some risky behaviors that people, as human beings, we're just human beings, like I said,
very true,
take part in. What are some of these risky behaviors?
Well, it's very sad indeed when the abuse of drugs goes to such a way. But according to now how the system works, it's not easy, as somebody might be able to think that I can just be able to walk in and give out my story and they're going to buy the whole idea and give me the drugs. It doesn't work like that. But some of we usually call most at-risk population, whereby we have people, the IDUs, people who inject drugs. We also have the MSM, men who have sex with men. We also have the fishmongers, the way last time we talked about it.
Yes.
And also we also have the female sex workers, and also they are being given, some of them, because it's pioneering, some of them are being given this so that we can be able to see how effective the drugs are. And I won't encourage any viewer who's watching me to go and just expose themselves, putting at the end of or at the back of their mind that I'm going to get these drugs. The drugs are there. But I'll just like to tell them it's not as easy as they think. They can just walk into a facility and tell their story, and then thinking that the person who's there, healthcare worker who's there, is just going to buy their story. Yeah, it takes a process, and there's a system towards just assessing all of this.
So as an individual, there are some lifestyle choices that I could make to put me at risk of getting the HIV virus. What are some of these lifestyle choices that I can avoid to be at risk?
One of it is, let me start with sex.
I mean,
because it's a major factor. Around 75% of all infections of HIV are being gotten from there. Sex, the way I said, abstinence, abstain, abstain, abstain.
We'll sing that song.
Abstinence.
The whole show.
And there's this thing people usually say, secondary virginity. You started, you've already expose yourself earlier on to sex, and now you've come back again, you said, I'm going to stick to the letter A, which is abstinence. You can still do it. Yeah. The second one is B, that is being faithful. I said being faithful doesn't go with words. It has to go with actions. Both of you, I don't want to say partners are female and a male partner. I just want to put it widely, because any person might be watching who is indulged with men, who have sex with men, or who also is female, in a female relationship. So I'll just encourage them, first of all, to go for a testing, then they decide to be faithful. Then the last one is the condom, which is very effective if you cannot abstain. You're fighting yourself with all these feelings and affections that are going, and the passions that are going in through you. We encourage you to use a condom.
So let's say, those are some of the ways myself as HIV negative person. So as a person living with HIV and AIDS, how do I prevent myself from making, those bad lifestyle choices and just transmitting the disease?
Actually, the first one I've mentioned is sex.
Yes.
The second one I'm going to mention is about injectables. Please don't share needles, don't share anything that can be able to expose somebody else to HIV infection. Even you yourself as already being infected, it's also very important. Also, you yourself, don't share these things, or don't share from another person things assuming they are okay. I'm the only one who's the victim, and you get out that again you get another reinfection or another HIV strain that you don't have.
Perhaps the viewer is wondering, what are these injectables you're talking about?
Some of these are needles, shindano. They are very different kind of needles, so I'll just say needles. There are those ones I don't want to mention on the health facilities, because nowadays there's no any single chance that you'll get. I've been injecting a client with the same needle again. I got to inject with another. So in the health facilities we are good to go, but at home,
yes.
Surrounding the people who use drugs, it's very important for them just to watch on these things to avoid getting infected. Also, toothbrushes. It's also very important to use your own toothbrush.
Oh, I know that's a new one for you, dear viewer. Toothbrushes.
Toothbrushes. I don't want to say it has a very high rate of getting infected, but we are just saying prevention is better than cure. Tunasema tumia mswaki yako wewe peke yako. You might be there as a parent or a caregiver who's HIV positive, and you have babies or children around who are not infected. Where do you store your brush? And you know how children are so picky. They get yours and they also brush. Me, I have an experience. So it's just good to check on all this. Another thing is being HIV positive, and some of the ways people might be thinking that somebody, or some of the myths, like using toilet, bathroom, and dry kissing, those ones I can say is just nil from getting HIV infection. But anywhere that you have open wounds or cuts, it's also very important just to try to wrap them or bandage them, so that you avoid any infection, not only HIV, but any infection. It might be bacteria or fungal infection that might be able to get access through those cuts.
So away from that, another interesting one is circumcision. And I remember there was a time where there was a very large campaign on males getting circumcised, and they would round up schools, male students, male pupils to get circumcised. And it's I understand it's a key process for HIV prevention. How is that?
Very true, and I really support the research that was going on. It's called voluntary male circumcision, which has been there, and I still know some facilities are still going on with it. We say a man who has undergone through circumcision, for him to infect a partner, let me not put on this on the gender, for him to infect a partner, the rate is like minimal. Compared to a man who has not undergone through circumcision. We usually say bado akona koti and ana kabuti, Now unajua when you
Uncircumcised.
uncircumcised.
Okay.
And when you know when you still, like right now, when I'm still having a coat, it means nothing is huku siezi oga. Maji yezi fika huku.
Oh, Brenda, in your examples.
The water cannot get this side. So it's very important when the coat is not there.
Okay.
Because the foreskin itself carries a lot of infection. It's not only HIV. Hygienically, it's also, it doesn't work 100%. So we'll encourage even viewers who are watching,
Yes.
who have not undergone circumcision. Don't say you are too old to undergo it.
Okay.
Feel free to walk into our health facilities. The providers that are there are very friendly, and you're going to get the best services. Now, usiogope kupona. It will take a bit of time, like 6 weeks.
Okay.
If you're somebody who's working, you can get a leave. Then you can be able to be given the best services for you just to reduce.
So you say it doesn't matter the age. Let's say I have a small child, a boy. How soon should he be circumcised?
When I look at a small baby, I'll go biblically, and I don't want to put my values in the show, but I'll say the way the Bible says, 8 days old. If you can be able to do that as a mother, before moving out of the hospital, if you can be able just to make sure that your baby has undergone through this well and good, so that when the umbilical cord itself, when it heals, the same time as the foreskin also falls off, and also the same time it heals.
Oh, so it's very advisable.
Very advisable. But when you look at VMMC, that is voluntary male circumcision, we are looking at the age gap from 15 years.
Okay.
It's very important for somebody just to get circumcised. Very, very, very. It's vital. Let me put it's vital. Yeah.
It's vital for yourself, hygienically,
even to your partner.
To your partner.
Very true.
So let's wind up with there's this phrase, treatment as prevention. Every time you read some literature on HIV and AIDS, you'll always find the phrase treatment as prevention. How is this so?
When you look at treatment, basically we look at the art itself, the antiretroviral therapy. It's very important. The sooner you get to know any infection, and don't sit at home and assume and going over the counter.
Yes.
Going over the counter, I won't encourage that. So the earlier you know how your system, especially HIV, you know you are HIV positive, please, those who are doing self-testing at home, please come back to the facility so that you may be able to get more support, especially on the art. Already those ones who usually test within the facilities, they are lucky, because we try to initiate as early as possible.
Okay.
So art itself is there. It really manages the HIV virus. You asked me today, Brenda, if I turn HIV positive, how many years I'm going to live? I don't know. You can live so many years when you're HIV positive, and you do so many things, because God is the one who owns life. Not just a long life, but a long, healthy and life. Productive. Very true. Life. Very true. So thank you, Brenda. Thanks a lot for prevention. We're learning so much. It's a learning process, and at the end of these sessions, dear viewer, believe you'll be mesmerized. Information is power. You know, information is power. As long as you're equipped with it, and we're equipping you with this information, because it's very crazy how much people hear about HIV and AIDS, but they know very little. And it's our privilege to be here with you and to be talking about all these things. So as you had, treatment as prevention, it's very key. ART can manage in the prevention process. On our next episode, we'll be talking about treatment, and we will let you know everything you want to know, everything you need to know about treatment on HIV and AIDS. I've been your host, Candy Odhiambo. Thank you so much for watching, and remember to share your views, share your opinions, share whatever you have on our social media pages. That is on Facebook, Hope Channel Kenya, on Twitter at Hope_Kenya. SMS us through the line running down your screen. Until next time, thank you for joining us.